Well, good afternoon, everyone. Welcome to those of you joining our first in a series of webinars with our partners from the Michigan Department for Health and Human Services. I am thrilled to have everybody here. My name is Tom Leitz. I am the Associate Director for Training and Development at MASSP, and I'm thrilled to host this webinar. We have with us a few wonderful guests. And first is Grace Rudolph, who is somebody many of you have met at a variety of our conferences. If you've been at the AP Summit, Grace has presented there. She is with the Michigan Department of Health and Human Services Department on Youth and Youth Adult E-Cigarettes Consultant and Tobacco Prevention. And we are really, really fortunate to have with us Dr. Farid Shamo, who is an epidemiologist. He does work in a variety of sectors of public health, but recently working with Michigan Department of Health and Human Services around commercial tobacco use and studies on tobacco use with various groups around the state and age groups. We are excited about this because it kicks off what is a three-part webinar series, at least this spring, and will hopefully roll into the fall. But today we're going to be talking about commercial tobacco use amongst Michigan's youth. On Thursday, May 22nd, we'll have the second of these, which is on new and emerging tobacco products. So kind of keeping you in the know. In the 15 years that I was a principal, at least the last 10 of them, I know the rat race of trying to figure out what was actually out there that I needed to be worried about, help my parents be aware of so that they could be active participants in this challenge was great to have. And then finally, on June 5th, we have a one that we haven't even sent out, but we will next week, which is going to be about moving beyond zero tolerance and rethinking school policies around preventing and combating tobacco. So we're really, really excited to have this partnership with MDHHS. And I am going to turn it over to Dr. Shamo in just a moment. But before that, I want to remind everybody that we'll have the chat open as well as our Q&A. So if you have questions of Dr. Shamo as this is going on, please put them there. Both myself and Grace will be monitoring the chat and the Q&A. And if anything comes up, we'll be more than happy to interject on your behalf and share those so that we make sure that everybody can hear and see those questions. So with that, I want to thank Dr. Shamo so very much for being with us today to share his wisdom and knowledge and what he's learned around commercial tobacco use in Michigan youth. So Dr. Shamo, I'll give it over to you.
Thank you, Tom. Thank you so much. And really, it is my great pleasure and also my great honor, really, to present and meet such a great people, principals in our great state of Michigan. We highly, highly value and respect, really, your role and your hard work, really, educating, training, and raising really our kids and our students. So I would like to throw some light during this presentation, my slides, about the behavior of high school students or the youth in general, for tobacco use, the type of tobacco use, also their attitude, some of their knowledge, and also the rate of using which one, and also will show you some trends over time to give you idea about what's going on in the school recently. So our mission is the MDHHS is to provide services and administers programs to improve the health, safety, and prosperity of the residents of our great state of Michigan. I thought, to start the presentation, we'll give you some background about the tobacco use and smoking among the general population, so that you will get an idea about, to compare the general population and also what is happening among youth. So this is about the general population, and this is from the Behavior Risk Factor Surveillance System, which is very, very, very trusted nationwide survey. So the red, you see the red line is the United States average, And the blue line, I always, draw Michigan with the blue line, to indicate the water and the lakes, etc. So the blue is Michigan. So this is over time from 2011 till 2023. This is the recent one that we have, 2023. So you see, it is always Michigan are smoking, and this is, by the way, the adult cigarette smoking rate. So always Michigan are smoking uh, uh, above or higher than the average of the United States. Now we are at 13.6%, and versus 12.1%. Hopefully, the gap is narrowing because, if you see after 2020, there is a steady like decline of, or a little sharper decline of smoking rate. And this is the e-cigarette. So that one was the cigarette smoking, and this is the e-cigarette smoking also among adults, so that you will be aware. So in 2018, it was 6%, and now it is 8.4%. So it is increasing, and it is increasing because the new generation that from high school and middle school, they are, and because of the epidemic of e-cigarette use in high schools, then they, when they came to the adulthood, like being 18 and above, then this is increasing. So over time, if you see, it is increasing. And if we do a micro analysis, but I don't think I brought that slide. If we do micro analysis, we will see the age group 18 to 24 has the highest e-cigarette use rate. It's about above 20%. But anyway, now in general population, it is 8.4%. And I thought it is a good idea to show you where Michigan, among their neighbors, among our neighbors. So this is Michigan in the middle. We have, as we said, 13.6% cigarette smoking rates among adults in general population. And compared to Indiana and Ohio, we are smoking lower than Indiana and Ohio. Ohio is 15% and Indiana 14.5%, but we are smoking higher than Wisconsin and Illinois. Illinois is the lowest, is 10.8%. And also to give you an idea about the smoking rates during pregnancy, so that you will have all the background of the smoking. So this is also a cigarette smoking. Also over time, if you see the blue line, as we said, it is Michigan, and the red is the United States. So also in the past, 5 years, really, after COVID, or, there is a steady a decrease or a little sharper decrease in smoking rates. So now we are at 6.5% smoking rate during pregnancy, while, versus 3.6 among the national average. This is also to show you who from the populations, what sector or what type of populations are more smoking, are highly smoking, or are more impacted by tobacco use than other population. So I put this, if you see this vertical line, this is the state average of any tobacco use. By the way, this is not cigarette. This is any tobacco use, any tobacco use. So all tobacco use, like including cigarettes, cigars, cigarillos, and e-cigarettes, chewing, smokeless. So any tobacco use. So the state average is 22% in 2023. So you see, those groups are highly impacted than the general population. So the first group is low SES, low socioeconomic status. And this is, combined two elements, the low income, the poverty level, and a low educational level, lower than high school. So you see, it is 48%, almost 50%. So almost half of this group are using any tobacco product. And of course, this will be reflected on the smoking rate or tobacco use rate or e-cigarette use rate among youth, because all of us know that if there is one using tobacco in the household, this would influence negatively the youth. And so the youth are high school students that is living with someone in the household who's using tobacco is most likely will use tobacco also. So the second one is Medicaid holders, also 43.2% are using tobacco. Heavy alcohol drinkers, 39%. With poor mental health, 35%. LGBTQ, 30%. People with disability, 31%. And African American, 27%. The Arab American, 24.1%. And I believe this one for the Arab American is because of the hookah. Because if we do the cigarette smoking, they have lower than the state average. Okay, so that was like some background about the smoking in general population. So now this is the first slide about among youth. And we are using the Youth Risk Behavior Survey, which is YRBS. This is very trusted also nationwide survey. And we got all those numbers from Youth Risk Behavior Survey. And also we have some others I will talk about in the coming slides. They are from the Youth Tobacco Survey, and I will mention the difference. Okay, so this is a current cigarette smoking rate among high school students. It's like a trend over time. From 1997, it was 38.2%. It's very, very, very high. And, all of us, including you, we were fighting and, protecting, preventing, educating our kids to quit and to reduce smoking. And we could achieve, 10% really in 2015, and then more sharp reduction, 4.5%, 1.7%, and now we are at 2.1%. This is cigarette smoking among youth, among high school students. This is the tobacco use in general, but really mostly it is, the e-cigarette use. You see, it is from 1999, we have 39.2% were using any tobacco use, of course, including cigarette. So at that time, it was a cigarette smoking. Those years, 1999, 2001, 2003, until, and we could reduce it as we, mentioned in the previous slide, we could reduce it to 17.9%. All of us, as I said. So in 2013, it was reduced to 17.9%. This is tobacco use, like any tobacco use. But unfortunately, you see the hike this is the hike because of the e-cigarette use. So in 2015, we hiked to 29%, and then to 23%, and then stay in 23%, and in 21, 14%, and now we are at 16.5%, a little higher than the national average. And again, this is tobacco use, including everything, but it is mostly after 2015, it is mostly influenced by the e-cigarette use. This is, the e-cigarette use rate among counties or inside counties. So this is also in 2023. So we use, because, those surveys, the national surveys does not go to deeper to the counties. But we use the MiFi, and I believe some of you are aware. about the MiFi, which is the Michigan Profile for Healthy Youth. And this is an optional really survey that, many counties and really most of the counties are performing those surveys. So we could collect, data, for the counties. So you see, I mean, the light green, the e-cigarette use, 5 to 10%. Those are the light green. And then 11 to 15%, a little darker green. And then a darker one is 16 to 20%. And this is higher, really. So 16 to 20, you see many, many counties, they have a 16 to 20%. And the highest is 21 and above. And this is huge, really, very high. And those are the very dark green. And I believe it is here, the Huron County, the Bay County, and Ionia, Lake County, Mason, and Emmett County. So those have the highest in 2023. This is back from the Youth Risk Behavior Survey. Those are the percentage of high school students who ever tried smoking cigarettes. So there is ever tried smoking cigarettes, and there is a current cigarette smoking. So the red colors are ever tried cigarettes, and the green are current cigarette smokers, because not all of them, they sustain, smoking. So you see in 2017, we have 10.5%, and then it is down to 4.5%, 1.7, and 2.1, while the ever tried is 30, 20, 13, and then 16%. They are trying, or they are back to try cigarette smoking. And this is for e-cigarettes. So those who ever tried, the red color, and the green is the current e-cigarette users. So you see in 2017, 44.5%, almost half of them, they tried the e-cigarettes, maybe one day, maybe many days, and then some of them, they sustain, they like it, and they kept, doing it, and they were like, we call them a current tobacco users, e-cigarette users, sorry. So you see in 17, 14.8%, and then 20.8 in 19, and then back to 14%, and 15.4 in 2023. So in 2023, the e-cigarette use in Michigan high school students is 15.4%, compared also to 35% they ever tried e-cigarette use. This is explained maybe more with some maybe explanation about why it's going up and down. So from 2015 till 2023, you see for the cigarette, which is the red columns, are the cigarette users, the current cigarette smokers. You see there is a sharp reduction and steady reduction. There is no wave from 10% to 2.1% in 2023. While the green columns are the e-cigarette use, are the current e-cigarette users. So in 15, as we mentioned in the beginning, there was a big hike, really, to 23% used e-cigarettes. And then because the national educational campaign against ends, and ends are the e-cigarettes, we could, reduce it to 14.8% in 2017. And then, we got another hike, 20.8%. And I believe most of you are aware about what happened in this year. So because of the Juul was targeting directly the high schools or the middle schools, the youth. So, it went up to 20.8%. And then we could, with our all partners, we could do a statewide educational campaign on Joule and also on flavor, even the governor, the governor office, all MDHHS, departments, and of course with the MDE and all of you participated maybe in that campaign to reduce it from 21 almost to 14% in 2021. And now it is 15.4, a little bit higher, but this increase is not statistically significant. But, there is a little increase in e-cigarette use in Michigan and not in the nation, because nationally there is a reduction in 2023. I wanted to, to show you some slides to, to clarify the impact of the tobacco companies, how they are targeting, our people and specifically our youth, because they are always investing in youth, because they know that, all the smokers, all the tobacco users in the nation, they started, smoking and using tobacco before the age of 18. So even from 13, 12 to 18. So about 90%, 85 to 90% of those started before that. So that's why they invest in this group among the youth. So this is the adult. This is the smoking rate, cigarette smoking rate among adult and by gender. So the blue line is male, smoking among male, and the pink line or red is smoking among female. This is the adult again. So you see, it was always, smoking among male, always higher by 3, 4, 5% all the time, over time, until 2021. There is the gap is lowered. So it looked like the female also are smoking as high as male. And this is, how the tobacco company play a role here, because when they saw the female are smoking lower than male, they said, oh, there is something wrong for us, for our investment. So we need to invest in female. So how can we do that? So I will show you the slide, then the coming slides. So this is among high school students, among youth. This is the tobacco product in general by gender. And the pink is columns are female and the blue are male. So you see the current tobacco use among female, and this is 2023, among female is 20% versus 13% among male. And the current e-cigarette use is 19.4% versus 11% among male. So this means that the tobacco company targeted our girls in schools, middle school, and high school, so that they will increase the rate. And of course they can do. They are very smart. They are very, very rich. They have, a lot of money. They can spend it on anything, on marketing, on media, on even on their designs, of the devices. So because 5 years ago, I mean, like before 2023, like let us say in 18, 17, male used to smoke or to use tobacco higher than female. But now we see like female are smoking. Why? Because this, this generation or females, when they are getting older and being adults, then the gap, between male and female will be closed. So female adults will be smoking and using tobacco similar to male. This is just an example, and it's very, data-driven example, really.
Dr. Shamo,
Yes,
Really quick, there was a question in the chat, and I think it's pretty appropriate with that last slide. And it's really
sure.
about, and it might be something that's not in your area of expertise, but perhaps something that's a conversation at the department, which is there any progress on statewide legislation to further increase penalties or to challenge the sale and distribution or even use of some of these like flavor combinations and things that they're using to entice our young women and our young men into using these devices. These conversations that you all are having with legislators in trying to help, really kind of assist what parents and schools are trying to do to prevent kids from having access to that.
Yeah, thank you. Yeah, although I am not the specialist in this, but all of us, knows those because we should be aware, about those because policy is very, very important to us. Anyway, so this was really there was a bill, in the legislatures last year. So it was about to pass, like in November, October, November, and then, they transferred to December. And it was like about 100% to pass. But I think some of you aware about what happens, in the Congress at that, time. And then, I mean, everything was stopped and was postponed. So most of them they postponed it, and there is a new cycle, there is a new legislatures that they joined, the House and Senate. So now, we have some agencies really advocate or they are advocating. I mean, those are advocacy agencies. They always like to help us because we cannot do, any those advocacy thing.
Sure.
So they are, helping us really to do something. So hopefully we can get something, in the next future.
Yeah, and I know that there was obvious the bill that I think many thought might pass even in lame duck and did not.
Yes,
It was one
yes,
of the
yes,
many bills that
yes.
unfortunately died in that
Correct,
a somewhat
correct,
unproductive lame duck piece. So yeah,
correct.
good to hear. And Aaron, one of our board members asked that question. Aaron, I'll certainly we follow that up, and I know Bob. Our lobbyist certainly does advocate for those pieces that come out of these conversations and continues to push for those kinds of regulations. So thank you, Dr. Shamo. Appreciate you taking a
Sure.
stab. What I know is more of a policy question, not a research-based question, but certainly the two are very much adjoined.
Thank you. Yeah. So back to the slides. So this is the high school students who use tobacco in general. So the red columns are the current tobacco users. And the red columns within those are those who tried to quit in the past year. So if you see in 2015, 50%, 52% of the tobacco users, they try to quit. And then it is 46% in 17, 53 in 19, and then in 21, 49%. 62, it's now higher. In 2023, it is higher. 62% of those tobacco users, they are trying to quit. They tried to quit in the past year because they feel that this is very dangerous to them. It look like they are stuck and they are addicted and they are it is like affecting their and we will see some of the questions how they answered those questions the high school. So in 2023, yes, we have 62%, which is some of a good news that students are thinking about quitting. And this is the cigarette and e-cigarette use by race and ethnicity. So the orange columns are cigarettes, while the green is the e-cigarettes. So this is the Native American, and it is like, they are using both cigarettes and e-cigarettes higher than the state average, and for cigarette and for e-cigarettes. The Asian are lower. The Black or African American also, like, it's similar maybe to the state average. The Hispanic Latino, and I noticed that because we did like a huge survey, a comprehensive survey among this population 2, 3 years ago, and we found that, their youth are using e-cigarettes higher than before, really. So now you see it is 16.2%, so it is a little higher than the state average. And this is the native also, Pacific Islander. It's a little lower, and the white is using e-cigarettes higher and cigarette, and then multiple races also using e-cigarettes and cigarettes. And this is by the LGBTQ or the sexual orientation. And really, this is a mistake. Like, it should be sexual orientation. The green are e-cigarettes. The orange is cigarettes. So this is the heterosexual. Both are in Michigan. So those are in heterosexual. So as we mentioned, 2% cigarettes and 14.6% e-cigarettes, while among the LGBTQ is 5.7% cigarettes and 24%, almost double in both, cigarette and e-cigarettes they are using. See how, the huge stress that those population have. And it looked like I put this slide also. So this is among the adult, but what, just a specific, category. This is the adult ages, we call them young adult. So adult ages 18 to 24. And this is highly impacted by the youth, high cigarette, what happens in the a few years ago. So you see in 2017, by the way, the red columns are the cigarette use, and the blue is the e-cigarette use. So in 2017, you see they smoke cigarettes more than e-cigarettes. And then if you see over time, cigarettes is lowering while e-cigarette is getting up and up. So you see now it is 23.7 or 22.2%. They are this age group. Those are adult. They are using e-cigarettes. Compared to before, it were like just to 17, it was 12.8%. So this is, as I mentioned, it is because the youth that they are getting older and becoming adults, and most of them because of the severe addiction of the e-cigarettes, so they are still keeping using the e-cigarette. They cannot quit using it. Yeah, so I put this slide to just to the slides I will show you next is from the Michigan Youth Tobacco Survey. And Michigan Youth Tobacco Survey, we used to, to conduct this survey like every 3-4 years, but we haven't since really 2011. So this is, we tried really, we planned to conduct it in 2020. And, we were hit by COVID and we postponed it to 21, 22, until, from 21, 22, and 23, we could, complete this survey. This is very important survey because, we use about 100 questions about tobacco use. We ask 100 questions about tobacco use, while in those, before, they use just about 10 questions about tobacco use. So we assess the behavior in more details in this tobacco use, Michigan Youth Tobacco Survey. And by the way, because we are talking about this, I will, really encourage all of you because we will conduct this in fall and winter this year, like in maybe October, November, and maybe we'll go to January next year. So we will do like a random selection of the high school in Michigan. So, I mean, please, when you are approached, by the group, we are partnering with Michigan Public Health Institute, MPHI. So if you are approached, please, because this is great. And I will show you the slides to convince you, I mean, how important is this? Because we need also to see the trend from 23 to 25 and 26. Yeah. We asked them about the age, how old you were when you first tried using e-cigarettes. So you see, 13 years or earlier, they said 13 years or earlier, 55% of them, they said 13 years or earlier, 14 years or old, 23%, 15 years, 10%, 16, 8%, and 17, 3%, and 18, 1%. So as I mentioned before, how the tobacco company, why they are investing in youth, because, you see, they are, they start smoking very early, like 13, 14, 15. So if you add those, it will be almost like a 95% they started using the e-cigarette. This is very important slide. This was not in the behavior that the youth behavior risk factor surveillance. And this is, we ask the students like who use tobacco, those who are tobacco users, we ask them if someone living with them in the household are using one of the various tobacco products. So 66% of those tobacco users, they said, yes, there is someone is smoking cigarettes. 48% of them, they said, yes, someone is using e-cigarettes. And 14%, they said there is someone using chewing, snuff, and 13% cigarillos or little cigar, 7% hookah, 6% pipes filled with tobacco, etc. So you see, this is very important, influence of someone, I mean, smoking in the household, and that will lead to most probably that, or most likely that the youth will start or will use tobacco. Those are some exposure to smoke from any tobacco product during the past 7 days. So we asked them whether they were exposed to secondhand smoke. So this is like at home, secondhand smoke exposure at home, 23%. They said they were exposed to secondhand smoke at home. Well, it is not only cigarette, any tobacco product, like even e-cigarettes. This is in vehicle, 23.3%. They said yes, they were exposed in vehicle. This was strange for me, really. 16.4%, they said they were exposed at the schools. So they were exposed to someone's who were smoking, and 16.4%. Those are like different that's some policy in home and vehicle. So smoking is allowed in their home. 23.3%, they said yes, smoking is allowed in their home, and 26% they said smoking is allowed in their vehicle. And this is, we asked them how they obtained the e-cigarette during the past 30 days. So 20 1%, they said, I bought them myself, and I have someone else buy them for me, 25%. I borrowed or loaned them, 21%. And a person who can legally buy these products gave them to me, 11%. I took them from a store or another person, and I got them on internet. So internet is, sometimes we talk about, internet, it's of a huge, but it looked like, only few of them, 1%, they are getting their tobacco or e-cigarette really from internet. But the internet, of course, the media, the internet influence a lot, the youth to smoke. And then we asked them where you obtained or purchased the e-cigarettes. So 13, they said from a gas station, and 2% from a grocery store, drugstore, 3%, small or shopping center. So those are, like almost similar. They are like a grocery stores or drugstores. So it's like about 20% of them. So 1.6 on the internet, and a vape shop in the mall or stores, 9%. And then some other places not listed here, from a family member, from a friend, 40%, and from some other person not mentioned. But you see, it is 29%. If we add the vape shop, they, they are getting their e-cigarette. They purchase their e-cigarette, whether they are minor or they are 18. So we asked them whether they believe that tobacco companies try to get young people under 18 to use tobacco products. So 67%, they said yes, of course, while only 33, they said no. So, our high school students, they are smart enough to know that, tobacco companies are targeting them. Where students see tobacco advertisement from tobacco companies, 53% they say when using the internet. And as I mentioned, so this, internet influence a lot the advertisement, and 76% at convenience store or gas station, and 60% when watching movies. And in the past 30 days, they receive coupon from tobacco companies, 17%. And 23% in the past 30 days, they see an ad for tobacco on a billboard. So you see, those are, unfortunately, they are still there, and they are impacting our youth to use tobacco. Those are very interesting, slide, this one and the next one. This is the perceived harm of various tobacco product among youth. So the red piece of the bar is some or a lot of harm, and the dark green or the blue is little or no harm. So some or a lot of harm. So cigarettes, cigarillos, or little cigars, 87.6%. So 88% of them, they say they have some or a lot of harm. Chewing tobacco, 85.5%, and e-cigarettes or vape. We were expecting like e-cigarettes or vape, this will be lower, like, only 50% of them or something like that. But you see, it is also very high. 82%, they said, yes, some or a lot of harm, e-cigarette has. And hookah or water pipe is also 82.4%. And this is perceived harmfulness of various tobacco products compared to cigarettes. So the comparison is to cigarettes. Just keep this in mind. So the red piece is more harmful, the purple is equally harmful, and the blue is less harmful. So for the cigars, cigarillos, chewing tobacco, and snuff, they said 17% are more harmful than cigarette, 17%. And you see, this is really the big finding. 27.7%, almost 28% of them, they said e-cigarettes is more harmful than cigarettes. So they recognize that e-cigarette is more harmful because, the tobacco companies are advertising and marketing e-cigarette as a less harmful. And sometimes they, made a fatal mistake when they say it is safer, alternative. And, we always say there is no safe tobacco product at all. So anyway, you see, they are, they recognize that 28% is e-cigarette, and for the hookah is 14%. And this is also important perceived addictiveness of various tobacco products compared to cigarettes. So, cigarillos, 15% they said it is more addictive. By the way, the red piece is more addictive. So 15% they said cigarillos are more addictive than cigarettes. But see the e-cigarette, 38.9, 39% almost. They said e-cigarette is more addictive because they feel it. And I will show you the next slides. And hookah is 12.8%. They said it is more addictive. So this is, we asked them about their concentration difficulties, craving among youth tobacco users. So having difficulties with concentration, memory, and decision making. 30.7% they said yes, they have difficulties in those things. 31.4% they said they want to use e-cigarettes in the 5 minutes of waking up, in the first 5 minutes. This means severe addiction. And 53% they feel restless if they don't use e-cigarette. Also, this is one symptoms of the addiction. And those are the flavors they used in the past 30 days. 71% they said they used the flavored e-cigarettes, and I believe it is higher than that. I believe it is 100% they use flavored, because no one use a tobacco alone without the flavor. But there is maybe misunderstanding of the question. Anyway, so you see the fruit, 74.4%, candy, 41, and menthol, 40, alcohol, 12, chocolate, 8, and then clove, like 4.5%. And this is brand of e-cigarette tried by Michigan students. You see, Juul is number one. Juul is declining in many, many states, while in Michigan it is still one of the first brands that are used by our kids. Also, the maybe because we didn't have like a settlement, our state didn't, were not included in the settlement with Juul company. Anyway, so this is the Puff Bar and Sorin and Fuse, BD Sticks, and UFO, Rolo, and many. Grace know those more than me. And students' perception about tobacco use among peers. So 25% they said one of their 4 closest friends smoke cigarettes. 41% they said one of their 4 closest friends use e-cigarettes. So almost like half of them, they said that. And 50% students perceived that their peers use tobacco product in general. So half of the students, they feel and perceive that, students are using tobacco. And this is the medical staff inquiries about tobacco use during the past 12 months. We asked them whether the doctor asked them when they, visit the doctor. So doctor asked if you use tobacco or e-cigarette, 39% only. And this should be 100% screening. And we are working really with the healthcare providers to increase that. And then 33%, they said doctor advised them to not use tobacco or e-cigarettes. And and this is, a different variable is 65% they stopped using tobacco, including e-cigarettes, for 1 day or longer. And I think I mentioned that in one of the, although that one was from the youth risk behavior. This is from our youth tobacco survey, but it is the same. If you remember, it was 62 in that survey, while now it is 65 in this survey. So this is by LGBTQ. So the heterosexual, this is the Michigan, those two, and compared to the national. And the blue columns are heterosexual, and the orange are LGBTQ. So you see the 11, and by the way, this is the tobacco use in general. So 11% the heterosexual use, while 30.2% LGBTQ. This is among Michigan, compared to the national 14% hetero and 22 among LGBTQ. So we in Michigan, the LGBTQ are using tobacco product higher than the national level. We asked them, this is very important. We asked them, like whoever used e-cigarette devices with a substance beside nicotine. So 62%, they said they use it with marijuana. I don't know if this is surprising to you, but it is for me, really. 62% using with marijuana. So they just use the device to put, THS, and then used with another substances that is not marijuana. And those 30%, they use it with nicotine only. So only 30% with nicotine, while you see this, they use it. Of course, they use it with mixed. One time nicotine, the other time is maybe marijuana. And this is the current tobacco use among students who use alcohol. So current alcohol use, 30.6%, they use tobacco among this group. 72% they use tobacco among current binge drinker, and 57% among current liquor use. This is important slides about the cessation method. We asked them about cessation method used among high school students when they try to quit. Unfortunately, most of them, they said cold turkey. Cold turkey is they try to quit by themselves without, requesting or asking for help. And this is the least successful quitting method. 76%, they said cold turkey or quit by themselves. Some, they said friends or family helped them, 19%, this is good. And nicotine gum, 15.7%. Community program, 8.4%, school program, 6%, and internet quit site, 6%, nicotine patch, 4.8%, and phone quit line. Because we have a program in our quit line, it's very important also for the youth, but this is very low, 2.4%, and using medicine, 1.2%, and another method, 1.2%. Those are the school, public school district with tobacco-free policies. We have four categories of tobacco-free school policies. The category number 4, just to summarize it, category number 4 is the more comprehensive one that include any emerging tobacco product, and it is 24/7. And it is on campus and off campus. So you see, this is the blue part of the columns is the comprehensive. So this is a good, really. In 2023, we have 87% of the school districts, they have this comprehensive. And the least one, the poorest policy is the category 1, which is the old law. This is the law in Michigan, unfortunately. It's the old law, which is, it is a tobacco-free school during business hours. So after 6, anyone can smoke cigarette or can use tobacco, and also during the weekend. And it is on campus, not off campus. So fortunately, this is decreasing over time, and the comprehensive is increasing. This is the last slide. Those are also like in a map, the public health, because we need to know like who is sorry, excuse me, like who in the counties have 100% of comprehensive tobacco-free policies districts. So you see the blue, the yellow or the orange, whatever, those are the schools that they have comprehensive tobacco-free schools. And then the dark green is 81 to 91%. And then a little lighter green, 61 to 80%. And then 41 to 60%, the light green. And the white is not, the white is 0 to 20. And this is, you see, this is only one in the Upper Peninsula. So the lowest counties is Keweenaw and Iron, Lapeer, and Noyoga. So those are they have the lowest comprehensive schools. And, I mean, thank you so much for listening. And as this is my email, and please feel free if you have like any question, concerning this presentation or any other concerning any tobacco use in Michigan, please feel free to send me email and ask the question.
Dr. Shamo, thank you. And I know I shared a couple of posts that I didn't realize Grace's post didn't go through. One of the questions that was out there that I thought might be if you can speak to any of this and any of the data or research that was out there, or Grace can certainly jump in as well, was a question about any trends or data that might be helpful to principals to help them know what and you had a couple slides about cessation. Obviously, we know cold turkey is not particularly successful. But are there patterns or trends amongst youth that have tried to quit and done so successfully that school leaders, teachers, parents might be able to leverage in their efforts to help the kids that they're working with quit? Because we know they're doing it. It's a matter of how to help them, stop.
Yeah, I'm not sure if Grace would like to mention some of them or
Sure, I
Okay.
can speak to it, Dr. Shimo. Thank you so much for sharing. I think one of the most important things is being supportive to youth. What the data shows, and I actually just received an article today about how research shows that e-cigarettes nicotine concentration is increasing exponentially. And so what we're really seeing is that initiation period of just testing it out or being curious or my friends are doing it is really turning very quickly into a very addictive behavior where no longer are they just experiencing or trying different things or being rebellious. They're really being truly addicted to this, and it's only solidified with the flavors. So one thing that we recommend from the tobacco section is really looking at it holistically and knowing that this is a substance quit or a substance addiction problem. It doesn't go away overnight. It takes time. It takes that support. It takes really seeing and helping a child through behavioral changes. And one of that is through alternative to suspension. And that gives education to a youth that may not know the dangers of vaping or of nicotine tobacco, commercial tobacco use, and helping them through the process of quitting, identifying different behaviors that will help support them through. Some people work better with tracking things, so helping them track. Also, getting family members or influential community members involved as well. And I say that because a lot of parents don't know that vapes have an increase of nicotine concentration. They think it's still a coping mechanism or something that's going to support their child to calm down, to feel more relaxed, to feel cool, but really they're harming and hurting their youth. They don't know the true clinical uh, effects that the nicotine, these high concentrations of nicotine have on the youth's brain and on their other body functions. So getting them along on board to help is huge. But the big thing is getting them to a health clinician, somebody who can prescribe true nicotine replacement therapy. And that is going to be their most successful way of quitting, is having that alternative to suspension, but pairing that really with the NRTs or nicotine replacement therapy to help them wean off of the nicotine and then learn how to have those behaviors that teach them to say no more holistically and feel better and confident about really taking back their life from a substance like nicotine or
And Grace,
tobacco.
I think something that's really important about what you just said as we kind of wrap up today is that, I've talked to you about this. I know I spent 15 years as a principal, and when I got into my last placement, I was battling against vapes. I went hard with the stick method, right? Like we're gonna try
Yeah.
to, we're gonna discipline this away. And what we found was that that just did not work. And then we had to undo all of that because the reality is this is an addiction. It is a medical issue. And we were trying to, as sometimes we tend to do, solve that in the most simplistic and ineffective way that we could. And so one of the things I really appreciate about this partnership with MDHHS is that this one was about a lot of information. It was to give you baseline data to know what's going on, where the use is. And Dr. Shamo did a marvelous job of presenting all that. I've shared a bunch, and hopefully we'll be able to get a copy of those slides, and I'll send you an email afterwards. But secondly, we then have our next one, which is going to be about new and emerging tobacco products. And then that's on May 22nd from 1 to 2. And then on Thursday, June 5th, which I know is getting near that summer point, but we're going to have Amanda Gallagher from MDHHS, who's a tobacco policy consultant. And she's going to be leading our third webinar, which is Beyond Zero Tolerance and Rethinking School Policies on Tobacco, which I think is going to be tremendously helpful to our principals, APs, and school leaders to think about how they can revision the way that we are supporting students as they try to free themselves from this addiction, which I think is really what it is. They don't want to. You saw that in the rate of attempted quitting. It's just a matter of whether it stays or not, and that's based on the support they have. So, really, on behalf of MASSP, we are grateful to have this partnership. We're grateful for the data. Dr. Shamo, thank you so much for the exhaustive information if I were a principal, I would gobble up. I would be building into slides for my PTO, for my parent groups, my staff, et cetera, just to show them that it's not just us battling alone, that this is pretty consistent. And that really leads to those next conversations. So not seeing any other questions in the Q&A or in the chat. I want to thank you both for being here today. I want to thank our participants. As always, this is recorded, so we will process it. We'll send a follow-up to all those who registered, and we'll publish this on our website, on the anti-vaping toolkit page, as well as on our YouTube page for folks to access and share with staff and use otherwise. So Grace, Dr. Shamo, thank you both so much for being here today, for your contributions, and we really appreciate it. Thanks so much.
Thank you. What a great pleasure.
Thank
Thank
you.
you. Thank you.
All right. Have a wonderful day, everybody. Thank you.
Thank you.
Thank you. Bye.